Hi there, my name's Dr. Ramadani. I'm one of the GPs at St Wolfson Surgery in Southam. Now, we're well and truly into the winter at the moment, and we're seeing rising numbers of children with symptoms of viral infection. It's really, really common, and we thought it would be quite helpful to send this message and do this video for parents so they can better understand what we mean when we're talking about viral infections, what you can do about it, and the signs and symptoms to be looking out for that might mean that you need to seek extra help, either urgent care or through your GP. So, viral infections normally give a collection of symptoms, and that can include things like sore throat, runny nose, cough, earache, eye discharge, and sometimes fever as well. And often, with the collection of those symptoms, we tend to imply that that's like a cold or a viral infection. Now, they're really, really common, and there's probably no child that's going to go through this winter without having that collection of symptoms. Normally, the symptoms last for about 1 to 3 weeks, although the cough can go on for a little bit longer than that. And generally, things like paracetamol or Calpol can be really helpful with things like sore throats, earaches, and also with fever as well. So you feel free to use those when you need to. You can also think about using ibuprofen and just make sure that your child is staying really well hydrated by drinking plenty of fluid and they're getting the rest that they need. Generally, symptoms will gradually improve over that period of time. But there are some symptoms that might warrant urgent care. And those symptoms to be keeping an eye out for would be if your child was breathing very rapidly, struggling to breathe, which might be seen as sucking in under the ribs, between the ribs, or any sucking in just at the neck there. If they have any of that that makes you think that they're struggling to breathe, that needs to be seen absolutely urgently. Also, if your child is floppy, drowsy, lethargic, not responding right, those would be other reasons why you probably need to get your child seen straight away and urgently. So then there's a collection of symptoms probably to be aware of that might warrant a visit to the GP. Now, if your child has had fever for 5 consecutive days, it's probably best to get them checked. Or if they're having a fever that isn't going down despite the use of Calpol and Nurofen, and an example of a temperature is 38 degrees or above. So if it's not coming down despite those two, then that probably needs to be seen by a doctor. Also, if the symptoms haven't improved over the course of 1 or 2 weeks, it's probably worth getting checked out again in that sort of situation. Also, if you're worried your little one isn't taking enough fluids, there is the chance that they get dehydrated. So we always say if the fluid intake is less than a third of their normal, or they're getting dry nappies if they're still in nappies, then they probably need checking out as well. So those are probably the main reasons why you might need to see your GP. But otherwise, and in most cases, these symptoms will just get better by themselves. So try and follow the advice as before. Calpol if you need to, add in Nurofen if you need to, and hopefully over the course of sort of 1 to 3 weeks, things should improve. But if you get any of those other symptoms and signs that we talked about, make sure you do get seen by a GP. Many thanks.